State health leaders say Utah is ready to receive its first doses of the vaccine, something that could happen in a matter of days. Fox 13's John Funke joins us live to explain the timeline. John.
Yeah, guys, back in October, the health department here announced that those essential healthcare workers would be first in line to get the vaccine. And if all goes according to plan, the vaccine could be here for them by the end of next week.
Utahns should feel comfortable and confident in the plan that we've put together, and we're ready to execute it.
After what has seemed like an eternity, there's finally some light at the end of a very dark tunnel.
I think it's reassuring for us that the work group that we put together and who has been looking at this issue for the past many weeks and months essentially came to the same conclusion.
In anticipation of a coronavirus vaccine being approved by the FDA, a CDC panel recommended the first batch of doses be administered to healthcare workers on the front lines of the pandemic, a plan the Utah Department of Health drew up back in October.
So healthcare workers are just at a greater risk of being exposed.
The FDA is set to hold an approval hearing for the vaccine developed by Pfizer on December 10th. If it's approved,
they could be shipping vaccine within a matter of hours. And certainly not more than a full day.
The health department plans to distribute the vaccine in phases.
We've been working to identify the hospitals in Utah that are responsible for caring for the highest percentage of COVID-19 patients.
Following those essential healthcare workers, phase 2 includes those who live and work in long-term care facilities, people who work in essential industries like education and transportation, senior citizens, and other high-risk individuals. The group can likely be vaccinated after the new year.
The timelines are tricky and they're moving constantly. We imagine that February, March is when we will start getting into that phase 2, but it's possible that we get there earlier.
The health department hopes to have the vaccine available to the entire population by June or July, a prospect of hope, but not a reason to let down our guard.
This is not a switch. We're not going to turn this on overnight and things are going to be able to be back to normal. It's still going to be really important that people continue to take the safety precautions that they've been taking all year until there is mass uptake on this vaccine.
Another big question is just how many doses Utah will get. Well, think of it this way. Utah is about 1% of the country's population, so the state expects that the feds will send about 1% of the doses that they have available. It's a complicated process, but one that is finally becoming more clear. Live on the Hill, John Funke, Fox 13 News.